Biden intends to end COVID-19 and public health emergencies on May 11. President Joe Biden intends to end the COVID-19 national and public health emergencies on May 11, the White House said Monday. The White House, in a statement of administration policy announcing opposition to two Republican measures to end the emergencies, said the National Emergency and Public Health Emergency authorities declared in response to the pandemic would each be extended one final time to May 11th.
Subscribe our YouTube channel and click our bell icon for new videos.
Pandemic would each be extended one final time to May 11th. This wind down would align with the administration's previous commitments to give at least 60 days notice prior to termination of the public health emergency, the statement said. The statement added, to be clear, continuation of these emergency declarations until May 11 does not impose any restriction at all on individual conduct with regard to COVID-19. They do not impose mask mandates or vaccine mandates. They do not restrict school or business operations. They do not require the use of any medicines or tests in response to cases of COVID-19. The statement came in response to a pair of measures before the House that would end the public health emergency and the COVID-19 national emergency. The White House weighed in because House Democrats were concerned about voting against the Republican legislation to end the public health emergency that is coming to the floor this week without a plan from the Biden administration, a senior Democratic aide told 24newsread.blogspot.com. Democrats were concerned about the optics of voting against Republicans winding down the public health emergency, absent an understanding of whether and how we intended to do so from the White House, the aide said. As soon as we saw this bill, it obviously concerns the White House. So, it was important for them to weigh in. The administration argues that the bills are unnecessary because it intends to end the emergencies anyway. The White House also noted the passage of the measures ahead of May 11 would have unintended consequences, such as disrupting the administration's plans for ending certain policies that are authorized by the emergencies. The White House said it would extend the COVID-19 emergencies one final time in order to ensure an orderly wind down of key authorities that states, healthcare providers and patients have relied on throughout the pandemic. A White House official pointed to a successful vaccination campaign and reductions in COVID cases, hospitalizations, and deaths as a rationale for lifting the emergency declarations. The official said a final extension will allow for a smooth transition for healthcare providers and patients and noted that healthcare facilities have already begun preparing for that transition. The administration is actively reviewing flexible policies that were authorized under the public health emergency to determine which can remain in place after it is lifted on May 11. The aide told 24newsread.blogspot.com that it will be up to every member to decide what is best for their district and how they will vote on the legislation this week. Declaring an end to the public health emergency will also end the border restriction known as Title 42, which will also likely set up a showdown on Capitol Hill. Benefits of the public health emergency. The public health emergency has enabled the government to provide many Americans with COVID-19 tests, treatments, and vaccines at no charge, as well as offer enhanced social safety net benefits, to help the nation cope with the pandemic and minimize its impact. People will have to start paying some money for things they didn't have to pay for during the emergency, said Jen Cates, Senior Vice President at the Kaiser Family Foundation. That's the main thing people will start to notice. Most Americans covered by Medicare, Medicaid, and private insurance plans have been able to obtain COVID-19 tests and vaccines at no cost during the pandemic. Those covered by Medicare and private insurance have been able to get up to 8 at-home tests per month from retailers at no charge. Medicaid also picks up the cost of at-home tests, though coverage can vary by state. Those covered by Medicare and Medicaid have also had certain therapeutic treatments, such as monoclonal antibodies, fully covered. Once the emergency ends, Medicare beneficiaries generally will face out-of-pocket costs for at-home testing and all treatment. However, vaccines will continue to be covered at no cost, as will testing ordered by a healthcare provider. State Medicaid programs will have to continue covering COVID-19 tests ordered by a physician and vaccines at no charge. But enrollees may face out-of-pocket costs for treatments. Those with private insurance could face charges for lab tests, even if they are ordered by a provider. Vaccinations will continue to be free for those with private insurance who go to in-network providers, but going to and out-of-network providers could incur charges. COVID-19 vaccinations will be free for those with insurance even when the public health emergency ends because of various federal laws, including the Affordable Care Act and Pandemic-era measures, the Inflation Reduction Act and a 2020 relief package. Americans with private insurance have not been charged for monoclonal antibody treatment since they were prepaid by the federal government, though patients may be charged for the office visit or administration of the treatment. But that is not tied to the public health emergency, and the free treatments will be available until the federal supply is exhausted. The government has already run out of some of the treatments, so those with private insurance may already be picking up some of the cost. The uninsured had been able to access no-cost testing, treatments, and vaccines through a different pandemic relief program. However, the federal funding ran out in the spring of 2022, making it more difficult for those without coverage to obtain free services. The federal government has been preparing to shift COVID-19 care to the commercial market since last year, in part because Congress has not authorized additional funding to purchase additional vaccines, treatments, and tests. Pfizer and Moderna have already announced that the commercial prices of their COVID-19 vaccines will likely be between $82 and $130 per dose, about 3 to 4 times what the federal government has paid, according to Kaiser. Medicare provisions. The public health emergency has also meant additional funds for hospitals, which have been receiving a 20% increase in Medicare's payment rate for treating COVID-19 patients. Also, Medicare Advantage plans have been required to bill enrollees affected by the emergency and receiving care at out-of-network facilities the same as if they were at in-network facilities. This will end once the public health emergency expires. Less of an impact. But several of the most meaningful enhancements to public assistance programs are no longer tied to the public health emergency. Congress severed the connection in December as part of its fiscal year 2023 government funding package. Most notably, states will now be able to start processing Medicaid redeterminations and disenrolling residents who no longer qualify, starting April 1. They have 14 months to review the eligibility of their beneficiaries. As part of a COVID-19 relief package passed in March 2020, states were barred from kicking people off Medicaid during the public health emergency in exchange for additional federal matching funds. Medicaid enrollment has skyrocketed to a record 90 million people since then, and millions are expected to lose coverage once states began culling the rolls. A total of roughly 15 million people could be dropped from Medicaid when the continuous enrollment requirement ends, according to an analysis the Department of Health and Human Services released in August. About 8.2 million folks would no longer qualify, but 6.8 million people would be terminated even though they are still eligible, the department estimated. Many who are disenrolled from Medicaid, however, could qualify for other coverage. Food stamp recipients had been receiving a boost during the public health emergency. Congress increased food stamp benefits to the maximum for their family size in a 2020 pandemic relief package. The Biden administration expanded the boost in the spring of 2021 so that households already receiving the maximum amount and those who received only a small monthly benefit get a supplement of at least $95 a month. This extra assistance will end as of March, though several states have already stopped providing it. Congress, however, extended one set of pandemic flexibilities as part of the government funding package. More Medicare enrollees are able to get care via telehealth during the public health emergency. The service is no longer limited just to those living in rural areas. They can conduct the telehealth visit at home, rather than having to travel to a healthcare facility. Plus, beneficiaries can use smartphones and receive a wider array of services via telehealth. These will now continue through 2024. Other coverage. Food stamp recipients had been receiving a boost during the public health emergency. Congress increased food stamp benefits to the maximum for their family size in a 2020 pandemic relief package. The Biden administration expanded the boost in the spring of 2021 so that households already receiving the maximum amount and those who received only a small monthly benefit get a supplement of at least $95 a month. This extra assistance will end as of March, though several states have already stopped providing it. Congress, however, extended one set of pandemic flexibilities as part of the government funding package. More Medicare enrollees are able to get care via telehealth during the public health emergency. The service is no longer limited just to those living in rural areas. They can conduct the telehealth visit at home, rather than having to travel to a health care facility. Plus, beneficiaries can use smartphones and receive a wider array of services via telehealth. These will now continue through 2024. Can use smartphones and receive a wider array of services via telehealth. These will now continue through 2024.
Subscribe our YouTube channel and click our bell icon for new videos.